Nearly 2 years of pandemic isolation and illness have taken their toll, not only in deaths and lingering symptoms, but also in our heads.
Prior to the pandemic, there were around 1 in 10 adults reporting symptoms of anxiety and depressive disorder. And now our most recent research shows that around 3 in 10 adults are reporting these symptoms.
Working adults, the ones with the most responsibilities during the pandemic, seem to be the ones affected most.
We often refer to them as sort of a sandwich generation because they're stuck between children and teenagers and then their parents. And they're basically having to try to juggle working with caring for their parents who have more needs now because of their social isolation, as well as their children. And maybe they're educating their children on and off at home and trying to manage their social lives.
But really, psychologists say the pandemic has affected everyone. An overwhelming majority of Americans have a close relative or friend who has either died of COVID or has had a very severe case. Many have lost their jobs. Children miss spending time with their peers, and teenagers are likely to miss out on their school proms. Divorce rates are up. Experts call all this collective trauma, and one of the main reasons behind it is uncertainty.
When the September 11th terrorist attacks occurred, or there is a hurricane, or there is a tornado, there is a date that it started and it stopped. And what people do in the aftermath is pick up the pieces, try to rebuild their lives, try to emotionally recover from the event. That is very, very different from what we're seeing here. We didn't have a clear start. We won't have a clear stop. And this is chronic stress.
Experts say standard ways to fight anxiety don't really work in this case. Advice that's often given to people feeling down, like meeting with friends more, traveling, visiting parents, and exploring new places, are simply not safe during the pandemic.
And, how do you do that when the information that comes from the CDC or other informed individuals or regulatory bodies are like, don't go to crowded places. If you love music, don't go to a concert. Don't go to the movies. Don't go to church or to synagogue, because those are places where people congregate and they may be helpful in terms of you're dealing with all of what's going on with the pandemic, but those resources aren't there.
Psychologists themselves are experiencing the same difficulties as everyone else. Trauma expert Professor Lesia Brown of Palo Alto University says she tries to connect with friends and loved ones as much as possible.
This is the time to reach out to others. I've had a lot of friends from college that I haven't talked to in a long time call me, and it really makes me feel excited and happy. I'm thrilled to death that they made that effort to call me. Let's call each other. Let's stay in touch. Let's send each other a letter.
But experts say the trauma will not end suddenly, even if COVID-19 restrictions are lifted soon. They say for many people, it will take years to deal with the pandemic's psychological impact. For Lesia Bakalets in Washington, Anna Rice, VOA News.